All right.
Welcome to the inaugural Resource Spotlight with Steps Through OC, which is for ovarian cancer with the Clearity Foundation, featuring Jeanice Hansen, LCSW, MSW, OSWC, who is a lead ovarian cancer counselor. Welcome, Jeanice, and thanks for coming.
Hi, thank you so much. It's great to join you today, Kristen.
Yeah, so we just want to know, what is the Steps Through OC program and who's it for?
Sure. So the Steps Through OC program is very unique in that it helps patients and participants, their caregivers, or someone dealing with ovarian cancer manage the lived experience with ovarian cancer. We know that about 22,000 women are diagnosed with ovarian cancer each year, and over 233,000 of them are living with ovarian cancer as a chronic illness. So it deserves a unique support program. And the Steps Through OC program is designed to help reduce stress, provide a sense of control over the experience, as well as provide some strategies that will help manage and cope with the experience in a more effective way. And we do that by meeting with individuals for 10 sessions over 6 months. And in that time, we cover all kinds of resources and experience information that will help them during that time. So the 10 sessions is generally what we start with. Some people need less, some people would like more. And so we just evaluate as we go along in terms of meeting their individual needs.
Okay, how long is each session?
So each session lasts about an hour. Sometimes people want to meet less because they've got other appointments or other demands on their time, but usually we schedule about an hour each time. So we do an orientation session to make sure it's a good fit with everyone, and then we begin scheduling the 10 sessions. Usually we meet once a week for 4 weeks, and then every other week for a month, and then monthly for the last 4 months.
Okay. And I understand this isn't only for patients with ovarian cancer, but their loved ones as well,
Exactly.
or
So it is
caregivers.
for women who are dealing with ovarian cancer anywhere along their timeline. It could be when they're initially diagnosed. It might be later on in the course of their treatment. Any time is acceptable. And then, excuse me, we also meet with their caregivers individually, and those folks are assigned to a separate OC counselor. So the participant can be either the person dealing with ovarian cancer directly or their active caregiver, and they would each have their own OC counselor.
Oh, that's wonderful. So
Mhm.
how does somebody get signed up?
Well, they would sign up on our website, and I'll share that with you in a moment. But what I want to share with you first is some guidelines that helps us know what people need. So if you look at this, we have a list of 32 OC coordinates, we call them, which are topics and concerns that are very common throughout the ovarian cancer experience for both the person dealing with ovarian cancer, the woman who is in treatment, as well as their active caregiver. And it covers several topics. And so when people register, they let us know how they're doing in each of these areas, what's most important to them. And it gives us an idea of where we can start in our conversations with them. This is also all within the context of where they are in their treatment experience as far as the phase of their treatment. Are they just dealing with the diagnosis for the first time, the news of it? Are they adapting to treatment? And are they transitioning from the treatment into that waiting period where they're trying to figure out, who am I now? What do I do with this experience? And then, since ovarian cancer does carry a risk of high recurrence, then we also talk about how do you live with that awareness and manage each day to the fullest.
Mhm. So someone could potentially join your program at any point in this circle.
Yes, they could be at any of these 4 phases in their ovarian cancer experience, and they can be dealing with any or all of these topics at any one time.
Mm.
So it gives us a place to start. It's often very helpful for women and family to understand that these are normal and then be able to talk about them openly.
Okay. And what's sort of the background of the people who are offering the counseling?
So these are all experts who have worked in a medical facility or have worked in a position where they've been supportive in nature and talking to women about their coping experience as well as providing tools. So many of them are experts with social work or counseling or both, and they are available to help people through any aspect of their experience.
Wonderful.
So we don't provide psychotherapy, but we do provide active support around these issues, and often just an opportunity to talk about the experience and validate that it's normal and begin to give them some tools that they can use that will help them through it.
And I've talked to you before, and you also talked about there being a couple of types of experts that people can talk to as well.
Yes. So within our program, we have consultants who have expertise in nutrition or diet, who are specialized in oncology, as well as spiritual care. And we have a scientific team that helps women and their families understand the most current treatment options for ovarian cancer, as well as their biometric testing, and help them use the clinical trial finder that's very specific and updated daily with regard to clinical trial options for ovarian cancer treatment.
Oh, wow. So you can really get a lot of support through this program and through the Clearity Foundation.
Yes, and what's really nice is it works as a wonderful companion with any kind of support program that they're already actively in. So whether they're working with their social worker or dietitian at their cancer center, or a peer support group, or an individual therapist, we provide a nice way of bringing that all together where we complement each other. Often we can refer the participant back to their cancer center and give them some guidance with regard to questions to ask or who to ask and how to talk to their medical team about their concerns so that they feel empowered to really be partners in their care.
Yeah, sometimes it's really nice to make some plans or develop a list of questions with a third party who's not really heavily invested in providing your care. It's really nice.
Yes, yes. So we see people as individuals, not as patients, which is a different feeling in that relationship when the same ovarian cancer counselor talks with the individual over 6 months. It becomes more of a discussion around what's going on now, what do you need now, what's important now, and empowering women and their family to begin to ask for what they need. And we don't provide medical advice, but we do provide information and guidance about how they can get the expertise they need from their care team.
Yep, that's wonderful. So how do people get in touch with you?
Well, let me bring that up here on the screen if I can get my computer to work. There we go.
Okay.
So the best way to get a hold of the team and also enroll is to go through the Steps Through OC site. And when people register online, they're going to be asked questions about those 32 OC coordinates. So it helps us know where to start in terms of what's important to them now. They can also send an email or call directly. And if they wanted to go directly to the treatment decision support to learn more about the clinical trial finder or speak to that expert panel of scientists, they can also use the Clearity Foundation or the phone number that's listed here.
Okay. And how long does it take to get through the registration process if somebody wants to get involved with the Steps Through OC program?
Sure. So it takes probably about 30 to 45 minutes to register. It depends on how much time they want to give to each of those topics in terms of letting us know where their concerns are. And then once the registration is processed, they are assigned an OC counselor who will reach out to them by email or phone within 3 to 5 days. So it's very quick. And then we begin to schedule what times will work for them so that we can talk to them as quickly as possible.
Okay. Well, that sounds great. Anything else
Yeah.
you want to tell us about?
We're just so pleased to be able to have a partnership with you, Kristen, and Jasper, and other organizations across the country that help us get the word out. One of the things I didn't mention earlier is this program is free. So it is sponsored by the Clearity Foundation, and we're very grateful that we're able to provide this service to so many women and their families.
Yes, what a wonderful service. We're so grateful it's there. Well, before we go, I'm just going to make sure people know how to get a hold of Jasper as well. You're always welcome to be in touch in terms of coming to our website and clicking the Ask an Expert or clicking on the Help button, and you can talk to me that way. I also do one-on-one sessions with people, and you can email us at support@hellojasper.com. But thank you so much.
Yes, thank you. I appreciate the time to be here and be able to connect with so many resources that are helping women and their families. Thank
I
you.
agree. We're so grateful to have you there, and thanks for the time today.
You are most welcome.
Take
Take
care.
care.